Hi everyone, welcome back to my channel. So at this point, you probably have already seen my video on my new diagnosis. I thought I had posted that a long time ago. I actually didn't even have it scheduled. So by the time you see this, that one should already have premiered and you will probably see that I have a new diagnosis. So my channel may start to take a turn into maybe focusing a little bit more on endometriosis because that's kind of, top of mind for me right now. This is, I've had to take like a crash course in learning about endometriosis. I knew very little about it. I knew it existed, didn't really know what it was. And unfortunately, now I have to educate myself a lot, especially if I am considering surgery, which I'll have to do a video on that at some other time. So this video, I wanted to talk about my possible or probable endometriosis symptoms and, the timeline that took place in. I've blamed every single one of my symptoms on having a chronic illness. I was previously diagnosed with Lyme disease and then stiff person syndrome in 2018, and I've done videos on that. So I was just constantly, blaming those diagnoses for all the symptoms that I had. And at no point did I or any of my doctors consider that some of the symptoms could be due to something else. Now, there will be doctors that will tell you, well, those conditions can cause endometriosis or whatever. There is no evidence to suggest that. There are different theories about what causes endometriosis, but there isn't really one concrete theory. And I've just stopped believing doctors. Every doctor will say that whatever their specialty is, that's the actual illness, and endometriosis or whatever else you have is a symptom or some kind of, result of you having that, right? If you have Lyme disease causes everything else. If you have long COVID causes everything else. And it's like, I've kind of come to the conclusion that it's possible that some of these things were occurring at the same time, or that a condition could be dormant prior and not really too problematic. There is a such thing as silent endometriosis. And that possibly Lyme disease or development of some other condition could have brought this other condition to the surface or maybe worsened it. But I may have to do another video on that. So these are my possible symptoms of endometriosis. This is specific to me. Again, I say possible, probable, because I can't 100% say. I can't tell you how long I've had endometriosis. I can only give you a, kind of like my best guess, based on my first symptoms. But you'll see, it's kind of, a little bit convoluted. I've been chronically ill for about 20 years. I did not know for the first 7 that I had a chronic illness. So I've only known for about 13 years that I had something that was causing all those other symptoms. So keep that in mind. I never had regular periods. Since I started my period at 13 years old, I never had regular periods. I couldn't really compare it to my mom because my mom was also not normal in that department either. So it's hard to tell if it was just like a genetic thing or if something else was going on. So that was at 13 years old, right? Fast forward to, I'm like, 27, 28. I don't even know how old I was when I first got diagnosed with Lyme disease. And then that doctor subsequently put me on IVIG, which I talk about in some of my stiff person syndrome videos. It's very interesting because when I did that first round of IVIG, that one was strictly IV. I believe it was 20 grams per month. That lasted for a year. We did it once a month for 12 months. That was the first time my period became regular. So don't ask me why. I really don't know. I've asked doctors and they kind of give me weird explanations. But that was long before I was diagnosed with a chronic illness. And I think my periods were irregular since day one when I was 13. Did not have a chronic illness at that time. And for many years after that, I don't think I had really had this, whether it's Lyme disease or SPS. I didn't start having symptoms until I was, I think, around 2021. So again, that could be a symptom of endometriosis, but I don't remember ever having cramps or severe pain or anything like that, or even PMS. I honestly don't remember having any of that. I just remember that it was irregular. I could never tell when I was going to get my period, and so that was kind of an issue. And again, I was never taken to the doctor to get it checked out, so there's that. My first bout of severe pain was around 2011, 2012. I was 26, I want to say 26, 27-ish. And I was still working at the time. So I've been disabled for over 10 years. I think we're going on 12 or 13 years at this point that I have not worked. So that was a while ago. We're looking at 15, 16 years at this point. At that time, I was still undiagnosed, but I had already been having issues. I had been having pelvic floor issues. I had been having, recurrent infections, weight loss, things like that. So weird things that I just couldn't explain. But I still didn't know that I had something. So that I was still working. I actually had to, be taken to the hospital, and they told me I was dehydrated. So I was like, oh, I'm just dehydrated. I also noticed I was urinating a lot that day. And again, never put the pieces together, that it could be, I knew I had something. I knew something was wrong with me, but endometriosis was not even, I didn't even know what that was at that point. Had never even heard about it. So my blood pressure had dropped. I was taken to the hospital and they told me I was dehydrated. I think they gave me an IV of fluids and I was fine. They did not give me pain medication. I'm telling you, doctors will refuse to give you pain medication. They did not give me a single drop of pain medication. So I believed it. I was like, I guess I'm dehydrated, and that's all there is to it. I do believe I had taken Advil. The problem was that at the time I was taking the old school Advil that's brown. It's a little tablet, and it just wouldn't kick in fast enough. I have since switched to liquid gels, which kick in faster. So the fact that my pain did subside, I thought it was from the IV of fluids. It was just fluids. There was no pain medication in there, but it could have been because I had taken that Advil and the fluids probably just helped it circulate a little bit faster. So lots of confusing stuff. I would have a couple episodes like that per year. So severe pain, dry heaving, almost blacking out. But it didn't happen every single time. It would happen once or twice a year, and I always felt that the pain escalated very quickly and that I just couldn't catch it in time. So even if I took pain medication, it takes at least 20 minutes for the Advil, the liquid gel, to kick in. With the tablet, it would be like 30 to 40 minutes. I noticed the difference. That's why I switched to the liquid gels. So I eventually learned how to dose so that the pain would not escalate, or so that I would kind of catch it. But the one thing that I noticed is that, as time went on, the ibuprofen would blunt the pain. It would not stop the pain. So for the first 48 hours, I'm just blunting the pain, and, I can get through it. I can function. But there were times where I was like, man, just really isn't, it's not doing its job, and I still had to just chill. I could not go anywhere. To this day, I still will not go anywhere on the first day of my period just because I'm so scared. I've had recurrent infections over the years. You guys know that I had ureaplasma I treated at the beginning of, 2024? The end of 2023 to 2024. I've had BV going on probably 7-8 years at this point, and also recurrent sinus infections, which I'm currently struggling with another one. So endometriosis can cause immune dysfunction. Depending on the gynecologist that you get, they may agree or disagree. I had one doctor recently tell me, she's like, endometriosis does not cause infections, which I didn't say that it caused infections. I said, it could make you more vulnerable to infections, but Again, don't quote me on that. Each doctor has a different belief system, I guess. And I did for a short while several years ago have kind of like a cluster of UTIs during the summer. I just figured it was because it was hot, and that was why I was getting UTIs. And then I stopped getting UTIs for whatever reason. So endo, like I said, can affect your immune system by causing immune system dysfunction, microbiome imbalance, and chronic inflammation, as well as anatomical distortion that can make it difficult to fully empty your bladder. That's what can also cause UTIs. It can cause UTIs, SIBO, IBS type symptoms and all of that. So other hormonal related symptoms that I want to say, are probably related to having endo or to some kind of inflammatory, situation related to endo would be the night sweats. And I'm not talking about I'm having night sweats right now. I am going to be 41. And I had another gynecologist recently tell me, I told her, I said, I get actually, no, I think it was just a regular doctor. And I was like, the night sweats and stuff. And she's like, oh, tell me about it. Because I'm going, I'm 41 and probably going into perimenopause. I'm not talking about right now. I'm talking about years ago. That started years ago, probably in my early 30s, no later than my mid 30s. So I didn't think that was normal. And I'm not talking about, I'm just a little sweaty or I wake up hot. I'm talking about waking up drenched in sweat. I had never experienced that. And it was only at nighttime. I would be woken up from sleep, drenched in sweat. Insomnia with my PMS, only before I started my period. My sleep had never been great until I did some treatments. But the insomnia right before my period was really bad, to the point where sometimes even Benadryl would struggle to get the job done. Of course, other PMS symptoms like depression, even acne. I don't know if acne could be related to endometriosis. And long PMS. So I used to have PMS that lasted like 10 days, some like little cramping here and there, but just all of the other stuff like breast tenderness, the night sweats, the, insomnia. And I thought that was ridiculous. But again, nobody ever tells you that it's abnormal or anything like that. But I was like 10 days and then to have a 7-day period, that's like more than half of the month. And then we're back at it again, shortly out. I mean, it's ridiculous. So, I'm going to do another video on treatments that have helped with this kind of stuff. And this is why I'm attributing these symptoms to the endometriosis or to whatever hormonal issues that the endometriosis is possibly causing, because some of these symptoms have improved. And I'll talk about that in a follow-up video. Now, other symptoms that may or may not be related to endometriosis. There are some people that do have these as a result of endometriosis. In my case, I cannot confirm that because, like I said, I was diagnosed with Lyme disease and, with an autoimmune illness and all of that. So some of these can come with those diagnoses as well. So I can't really say for sure. This is speculation, but I'm going to include them here, just in case. So histamine intolerance, as you guys can see, I have continued to lose my hair. I've lost probably close to 80% of my hair at this point. That started in 2019, and there was something that helped it. I'll talk about that in another video. But I'm no longer on that medication. My hair has continued to fall out. It's falling out like crazy. So histamine intolerance, food intolerances can also be related to endometriosis. Hair loss can also be related to endometriosis. These are all things that I have during my research or just, listening to other women and communicating with other women. These are symptoms that could possibly be related to endometriosis. SIBO, IBS, bloating and distension can also be related to endometriosis. And sometimes this is like during the whole month. It can happen during the whole month. Sometimes it is just right before the period. I have it, to me, I've noticed the bloating happens after a round of antibiotics. But the SIBO, again, I had a doctor tell me he doesn't think that it's SIBO, but I don't know. I can't say for sure. And again, I just found out I have endo. So, I mean, you can make of that what you will. I've had, bouts of very loose stools. Diarrhea is something that is strongly associated with endometriosis. Diarrhea and constipation, which really blows my mind, can both be symptoms of endometriosis. Weight loss as well. I think they did like a study on rats or something, and if they had endometriosis or something. I can't remember the study. I should have looked it up. But apparently weight loss is related to endometriosis. Women with endometriosis tend to be thinner. There's some women that argue that that's not true. I think that one's kind of a, speculation on that one, but I have been very thin, and I am thinner when I am not on a certain medication. So I'll talk about that in another video. I did have some random nipple tenderness. I've had some menstrual irregularities as well recently. That can also be attributed to endometriosis. It could be attributed to a lot of other things as well, probably. This is one that I've always kind of, been, I don't want to say baffled by it, but I've never been pregnant despite never having used birth control. I have never been on a birth control pill. I have used other forms of contraception, but as far as using birth control pills or anything that I take, I've never been on it. I was married for a while, and there was a chunk of time there where there was zero protection or anything used. And I just was I was very confident about the fact that I was not going to get pregnant. I just, for whatever reason, have always kind of known or felt that I could not get pregnant. I blamed being thin on that. The funny part is that I've seen so many very thin celebrities. I'm thinking like Angelina Jolie, Victoria Beckham, these women who are very small that have had multiple children. I mean, Victoria Beckham has had 4. And they've carried their children. Angelina Jolie had a pair of twins and then another, single pregnancy. Again, we don't know if they've used IVF or whatever, but I don't know why I just always thought thin women, if you're skinny, you cannot get pregnant. Now that I have this diagnosis, I can kind of see like, well, there was probably something else to it. Endometriosis can cause fertility problems conceiving. It can affect your tubes, so that makes it difficult for the egg to reach the uterus, but also just the presence of endometriosis in your pelvic region can make it an inhospitable environment for pregnancy, I guess, because of the amount of inflammation. So could be any of those, or maybe I just was pretty careful. I don't know. So like I said, I do use, I have used contraception, in other ways, but just birth control pill in and of itself, I have never taken. So that's the list. I hope that this helps somebody. That's the reason why I'm making this video, because some of us here have so many overlapping things that we can't really say for sure, like, oh, I have this or I have that. But there is something that I've learned during my time being chronically ill, is that just because you were diagnosed with long COVID or Lyme disease or ME/CFS doesn't mean that you can't have any of this other stuff. And it's actually very common for people to get diagnosed with multiple things, with endometriosis and like Ehlers-Danlos or POTS, and we tend to have multiple things going on at once. And like I said, I don't know if it's that one caused the other, or if that one makes the other worse or sort of activates the other. That's kind of my theory, is that it was probably there. You can have something called silent endometriosis, where you do not have like pain or any very apparent symptoms, but it's often discovered when a woman starts trying to get pregnant and she can't. And then they go in there and they're just like, oh, you have endometriosis. And she's just like, I didn't know because I didn't really have like severe pain. Or in my case, I was like, yes, I have those bouts of severe pain, but I'm not in pain all the time, right? So I was like, that's not what endo is. Endo is when you're in pain all the time, and like all the time, because there's women that have pain throughout the month. It's not just related to their periods. So I just was like, there's no way. But there are different levels to it. There are women that have just a little bit of endometriosis, but a lot of pain. There are women that have tons of endometriosis and their pain does not seem to match the amount. So there's a lot to consider. I'll continue to make videos about that. And any other questions. I'm not a doctor, so, I'm just making these videos from the perspective of somebody that is already chronically ill and having to sort of sort out the different symptoms and the different issues and deal with them individually. So anyways, thank you so much for watching. Please like and subscribe, and I will see you in the next one.